This is the Joint Jack Chronicles, and we're going to be discussing the CMC joint. The CMC joint is the joint where the thumb metacarpal sits on the trapezium. And the problem comes in that this joint is very susceptible to degenerative arthritis. And I'm going to probably show you a little bit of it from a drawing. This is the metacarpal of the thumb. This is the trapezium. Ordinarily, the thumb sits pretty square on its carpal bone. If it is built square, it's not a problem and will last the rest of the patient's life. However, if there's a little increased slope, and this is the best way to think of it, just in a general sense without getting into the anatomy of a very complex joint, but think of it as having a little increased slope. That little increased slope means that every load applied to the tip of the thumb results in a lateral displacement or skid. The thumb metacarpal skids, shear loading occurs on the cartilage. No cartilage joint in the body will tolerate shear loading. These joints become degenerative, go to pieces because of their anatomy. It's not having familial degenerative arthritis. It's not because you work with the hand or the thumb on either side. That's why degenerative arthritis of this joint is almost always bilateral, and females have a higher incidence, and there's a hereditary component. But the key point of this at this stage is that this is a anatomy phenomena that results in degenerative arthritis of the thumb. If I have this situation and we just make that thumb metacarpal again and put the cartilage on it, I'm going to make it very large and put the cartilage on the trapezium in a large sense. This is a nice stable joint. It has collaterals that long, and if that has shear loading because there's increased slope in the joint, if we had a joint which has slope in it, such as this, that results in that shear loading, and this cartilage gets destroyed. If I move that along a step and we have the cartilage loss, then we have this situation where the destroyed cartilage is there, and here's the destroyed cartilage on the trapezium. And all we've done here, we haven't changed the length of the ligaments, all we've done is taken away the cartilage as the arthritis progresses. That is going to produce instability. I've accentuated it so you can see that this cartilage loss results in a collapse pattern, which results in lateral instability. You can do ligament repairs and ligament enhancements or add ligaments to try and bring this thumb metacarpal back in place, and that's a common phenomena. There's no point in doing it because you're going to bring it back. You have a degenerative arthritis in the joint, and this joint is already lost, if you will. There are two concepts in treating the CMC joint. The first, we're going to call it interposition, where they put something between the metacarpal and the trapezium, either a new metal joint, a piece of plastic, a piece of Teflon, a rolled up piece of tendon, and that's how they solve the problem. The other approach is, we'll call it suspension, where the metacarpal is going to be held distally. And between those two is the real answer to those two is suspension. Interposition is not something that's going to solve the problem long term. It'll work short term. People make a fair amount of money with various implants that they put between the bones, and the philosophy of putting something between the bones is enhanced by the fact that we've done that in many of the big joints of the body. But in the thumb, it's not the answer. The answer to the thumb is to suspend the metacarpal. And we'll go over the detailed surgery for a suspension operation that will successfully hold the thumb. It's done with the patient's own tissue, so it replaces itself. It'll take full load and has an essentially normal range of motion. And we'll discuss that in Joint Jack Chronicles in the future.